Hello everyone, this is Shijo Chandapalai, your favorite oncology clinical hypnotherapist. I help people to cope with cancer and create a healing mindset through cutting-edge hypnosis techniques so that they can come out on the other side as a survivor. Today I want to bring your attention to the reality that we really don't have any control over cancer. Cancer progresses, it will go away, we take treatment, things like that. But what we have control over is how we eat, the things that we eat, what we put into our body, right? So today I bring you this video talking about 7 ways to starve any cancer away. Please enjoy. If you have any questions, you can leave it in the comment section below. Like and subscribe. Enjoy this video. Thank you.
Cancer cells, unlike normal cells, are more active. They need more material, are more aggressive, have different mutations, and recover from damage more quickly. Even the least active cancer cells are still more active than the more dormant, normal, healthy cells. Deadly cancer cells can be starved and eliminated from your body, and it can all be done in a very natural and healthy way that doesn't rely on heavy doses of chemo or radiation. Using diet or drugs to restrict intake of some lipids or their use cells could be a path to starving a tumor without starving the person. In this video, we'll be talking about 7 ways to starve any cancer away. Watch now. Number 7. Use metabolism drugs. When cancer cells with this metabolic defect are deprived of environmental arginine, they're forced to shift from a system that burns glucose to a system that burns a different fuel called glutamine. Research shows that adding a glutamine inhibitor to the arginine-depleting drug is lethal to the cells. Eliminating arginine from the blood also rewires serine biology, another backup fuel, so adding serine inhibitors also causes cell death. Cancer cells grow rapidly and consume more fuel than healthy ones. These medicines make tumor cells easier to destroy by stopping them using glucose in the bloodstream for energy. Normal cells do not metabolize energy in the same way and so are not harmed. Some of the drugs used to starve cancer cells include aspirin. Aspirin has been used for thousands of years as a painkiller. The active ingredient, salicylic acid, was first extracted from willow bark by ancient Egyptians and used as medicine. A study of more than 200,000 women published last month found that those taking a 75 mg daily dose were nearly a quarter, 23%, less likely to develop ovarian cancer. It is thought this because of the painkiller's inflammation-busting abilities. Metformin. A trial at Vanderbilt University in the U.S. showed that patients on anti-diabetes tablet metformin had a reduced rate of liver cancer, suggesting that the pill could prevent the disease developing in the first place. Statins. Statins, traditionally used for lowering cholesterol, could also dramatically cut the risk of dying from breast cancer by 40% by halting tumor growth, say Chinese researchers. These findings are based on data from 200,000 women analyzed by the National Cancer Center in Beijing. Doxycycline. Another drug showing promise in cancer treatment is a 100 mg a day pill antibiotic doxycycline. According to new British research, these little blue capsules can kill the aggressive cells that cause tumors to return in some people with breast cancer. Doxycycline works on cancer by suppressing the ability of stem cells to make new mitochondria, the tiny powerhouse components in all cells that generates energy. It's an entirely new way of thinking about cancer. Number 6. Eat a healthy diet. What we eat matters, and when it comes to fighting cancer, many believe that it's possible to starve cancer with foods we put into our bodies. One believer is Dr. William Lee, who claims that eating cancer-fighting foods cuts off the supply lines that feed cancer cells. According to Lizzie Smith, myeloma survivor, about half of the population aged 50 and over already have tumors that, if are fed, could lead to cancer. Anti-angiogenesis prevents these cancer cells from ever starting. Wouldn't it be awesome if we could stop cancer in its tracks? It can also help cancer patients from relapsing, essentially keeping the dormant cancer dormant. A completely other side is starving cancer. Without blood, cancer cannot survive. Like any cell, cancer needs oxygen and energy, both of which are provided by blood. So if we're able to stop blood from getting to the cancer by drying up the capillaries, tiny blood vessels, then we can stop cancer right in its tracks. Although making healthy selections at the grocery store and at mealtime can't guarantee cancer prevention, it might reduce your risk. The following diet tips can help in fighting cancer. Eat plenty of fruits and vegetables. Base your diets on fruits, vegetables, and other foods from plant sources, such as whole grains and beans. Maintain a healthy weight. Eat lighter and leaner by choosing fewer high-calorie foods, including refined sugars and fat from animal sources. If you choose to drink alcohol, do so only in moderation. The risk of various types of cancer, including cancer of the breast, colon, lung, kidney, and liver increases with the amount of alcohol you drink and the length of time you've been drinking regularly. Limit processed meats. A report from the International Agency for Research on Cancer, the Cancer Agency of the World Health Organization, concluded that eating large amounts of processed meats can slightly increase the risk of certain types of cancer. In addition, women who eat a Mediterranean diet supplemented with extra virgin olive oil and mixed nuts might have a reduced risk of breast cancer. The Mediterranean diet focuses mostly on plant-based foods such as fruits and vegetables, whole grains, legumes, and nuts. People who follow the Mediterranean diet choose healthy fats such as olive oil over butter and fish instead of red meat. Number 5. Supplements and medication. There are plenty of supplements and medications available that contain anti-cancer compounds. Vitamins A, C, and E are notable for their anti-cancer properties and are available as supplements in most major grocery stores. Number 4. Maintain a healthy weight and be physically active. Maintaining a healthy weight might lower the risk of various types of cancer, including cancer of the breast, prostate, lung, colon, and kidney. Physical activity counts too. In addition to helping you control your weight, physical activity on its own might lower the risk of breast cancer and colon cancer. Adults who participate in any amount of physical activity gain some health benefits. Strive to get at least 150 minutes a week of moderate aerobic activity or 75 minutes a week of vigorous aerobic activity. You can also do a combination of moderate and vigorous activity. As a general goal, include at least 30 minutes of physical activity in your daily routine, and if you can do more, even better. Number 3. Avoid risky behaviors. Another effective cancer prevention tactic is to avoid risky behaviors that can lead to infections that, in turn, might increase the risk of cancer. For example, practice safe sex. Limit your number of sexual partners and use a condom when you have sex. The more sexual partners you have in your lifetime, the more likely you're to contract a sexually transmitted infection such as HIV or HPV. People who have HIV or AIDS have a higher risk of cancer of the anus, liver, and lung. HPV is most often associated with cervical cancer, but it might also increase the risk of cancer of the anus, penis, throat, vulva, and vagina. Don't share needles. Sharing needles with people who use intravenous drugs can lead to HIV, as well as hepatitis B and hepatitis C, which can increase the risk of liver cancer. If you're concerned about drug misuse or addiction, seek professional help. Number 2. Protect yourself from the sun. Skin cancer is one of the most common kinds of cancer and one of the most preventable. Some of the tips to try are: avoid midday sun. Stay out of the sun between 10 a.m. and 4 p.m. when the sun's rays are strongest. Stay in the shade. When you're outdoors, stay in the shade as much as possible. Sunglasses and a broad-brimmed hat help too. Cover exposed areas. Wear tightly woven, loose-fitting clothing that covers as much as your skin as possible. Opt for bright or dark colors, which reflect more ultraviolet radiation than do pastels or bleached cotton. Don't skimp on sunscreen. Use a broad-spectrum sunscreen, such as SPF of at least 30, even on cloudy days. Apply sunscreen generously and reapply every 2 hours, or more often if you're swimming or perspiring. Avoid tanning beds and sun lamps. These are just as damaging as natural sunlight. And number 1, don't use tobacco. Using any type of tobacco puts you on a collision course with cancer. Smoking has been linked to various types of cancer, including cancer of the lung, mouth, throat, larynx, pancreas, bladder, cervix, and kidney. Chewing tobacco has been linked to cancer of the oral cavity and pancreas. Even if you don't use tobacco, exposure to secondhand smoke might increase your risk of lung cancer. Avoiding tobacco or deciding to stop using it is an important part of cancer prevention. And that brings us to the end of our video. We hope you learned a lot, and be sure to subscribe to our channel for more of our awesome content. And please give us a like, share the video, and turn on the notification bell for timely updates. And I'll see you in the next video.